How to understand your DEXA scan Z-score. When you receive your DEXA scan results, you may notice a term called Z-score. Understanding what this means is key to interpreting your bone health. A DEXA scan Z-score measures your bone mineral density compared to the average bone mineral density of individuals who share your age, sex, and ethnicity. This comparison helps identify if your bone density is typical for your demographic or if it is unusually low, which could indicate underlying health issues. The Z-score tells you how many standard deviations your bone density is above or below the average for your group. A Z-score of 0 means your bone density is exactly average. If your Z-score is above -2, it is generally considered normal. This indicates that your bone density falls within the expected range for your age and sex. However, if your Z-score is -2 or lower, it suggests that your bone density is below the expected range. This may indicate bone loss due to factors other than normal aging, such as secondary osteoporosis caused by medications or medical conditions. Z-scores are particularly useful for evaluating bone health in children, teenagers, premenopausal women, and men under 50. For these groups, comparing bone density to age-matched peers is more relevant than comparing to young healthy adults. In contrast, T-scores are used to compare your bone density to that of a healthy 30-year-old adult. T-scores are primarily used to diagnose osteoporosis in postmenopausal women and men over 50. It is important to note that a normal Z-score does not rule out osteoporosis in older adults. Bone density naturally declines with age, so a normal Z-score in an older person might still indicate low bone mass or osteoporosis when compared to young adults using T-scores. If your Z-score is low, your healthcare provider may explore potential secondary causes of bone loss. These could include hormonal disorders, nutritional deficiencies, chronic illnesses, or the effects of certain medications. Your doctor will interpret your Z-score alongside other factors, including your medical history and fracture risk, to determine if you have osteoporosis or another bone condition. Treatment decisions and further testing will depend on this comprehensive evaluation, not solely on the Z-score. In summary, the DEXA scan Z-score helps identify whether your bone density is appropriate for your age and demographic group. It also signals when further evaluation for secondary osteoporosis may be necessary. Always discuss your DEXA results with your healthcare provider for accurate interpretation and personalized advice.